do the lower extremity, okay? So, you all set?
Yeah.
Okay, very good. All right, so this is a right lower extremity. We're looking at the femur, the tibia, the fibula, and then the right foot. All right, so we'll go through section at a time. Let's look at the femur first, okay? So we're looking at the proximal portion, the distal portion of the femur, okay? So proximally, we have the head of the femur. We have this indentation right here, the fovea capitis. We have the femoral neck right here. We have, you can view part of the greater trochanter, lesser trochanter, okay? Shaft of the diaphysis of the femur. At the distal portion, we have the patellar surface right here. We have, so this is the right side, so we have the lateral epicondyle right here, the medial epicondyle right here. Turn it over and looking at the posterior aspect at the distal portion. So if this is lateral, this would be the lateral condyle, medial condyle, intercondylar fossa. Okay? So then this would be the medial epicondyle, lateral epicondyle. Right here, there's a ridge. This is the linea aspera. Again, the lesser trochanter, greater trochanter, femoral neck, femoral head, fovea capitis. Move on. So here we have the fibula, lateral, the tibia. Okay, so let's look at the fibula first. We have at the proximal end, the head of the fibula. The distal portion, we have the lateral malleolus. This is where a patient would point to their ankle. They point to either the lateral or the medial malleolus. So, tibia, we have the distal portion. So here's the medial malleolus right here. Okay. Here's the shaft. We have the tibial tuberosity right here. We have the tibial plateau right here. We have the intercondylar eminence right here. And then the right foot. Okay. So we're looking at the bones from here. Proximal would be the tarsal bones, metatarsals, phalanges, aka digits. Okay. So let's look at the tarsal bones first. We have the tibia, the talus. Sorry, the talus. The talus articulates with the tibia. So the talus bone, the calcaneus, which is your heel, calcaneus, talus, navicular, right here, navicular. Now the next row of tarsal bones all begin with the letter C, and they all articulate with the metatarsals. So we have cuneiform number 1, 2, and 3, and then we have the cuboid bone right here. And then as far as numbering is concerned, here's the great toe. This is number 1, okay, hallux. So we have metatarsal number 1, 2, 3, 4, and 5, lateral aspect. Numbering of the digits, the phalanges, we have number 1, 2, 3, 4, and 5. The great toe has a proximal and distal phalanx. Numbers 2 through 5 have a proximal, middle, and distal phalanx. Very good.